Hey everyone, Dr. Charlie Johnson, a physical therapist and back pain specialist. I want to share with you today the story of Nick. So Nick had really bad back discomfort and just raging sciatica down his left leg for about 2 months. He had tried chiropractic, acupuncture, inversion tables, float therapy, specific exercises on his own, and he reached out to me, and I want to share with you sort of what we saw, because Nick had something we call a lateral shift, which is a very clear and classic telltale sign of a disc herniation. So you'll see it here in a moment. Just keep in mind he's got left leg pain, so you'll see that he's sort of shifted to the right. Again, this is a classic telltale sign of a disc herniation, and because of the clinical exam and the treatment, we were able to get him better really quickly. Actually, within one visit, 80% relief there, and we were able to prevent him from needing X-ray or MRI. He was actually scheduled for an MRI, but because of a good examination there, and because of what we know and how clear of a sign this is, we already knew what it was, and he was getting relief. We didn't need to go there. So check it out. Here's Nick. So you've got left leg pain?
Yep.
All right, so here we go. So we've got a classic, what we call lateral shift, which is basically somebody who's sort of bent forward to one side because they've got leg symptoms. So in this case, this guy here has left leg pain going all the way to his ankle. So we're trying to improve or straighten him up, reduce his crookedness. So this is something that we're working on, trying to get him back to neutral. Off and in, just a pulse all the way through. What do you got in the foot?
A little bit in the front, but it's more up in my butt.
Okay, so you got things are worsening up top, and maybe a little bit less, a little bit in the front, but not too bad all the way down to the foot?
No.
Okay, keep going. It's got to go more, and you're just pulsing there.
Yeah, it's just like a tight, like a fucking knot in my butt.
Yep, keep it going, man. Right, so we said that the worse the symptoms are in the foot, right? So the further the symptoms are down the leg, often the worse the condition. In this case, a classic telltale sign of a disc issue is a shift. So we're trying to correct that. It's taken some effort, so oftentimes you'll see it. This is, you can't crack yourself out of this, you can't massage yourself out of this. This is something that needs to be a correction. Either he's sort of doing it on his own, which is cool because he can do this then, if this is something we find works for him, at home or whenever he needs to, and take it, if we consider movement as medicine, you can take it like a pill, and we can do this repeatedly throughout the day. So again, this is often caused by a disc herniation, which causes the body sort of shift away from the side of the pain. In this case, his left leg was the symptoms, but often what we notice is that as we do this, the symptoms go from being really bad down near the foot or further away from the body, and they start to sort of march on up to where, you know, he was sort of mentioning a minute ago that the symptoms are getting more intense, like hamstring, buttock area, but that the foot is improving. So this is a positive thing, and we want to try to work into this.
This way?
Yep, so you inched arm up. So he inched arm up a little bit so he could go further into the motion now that we regained it. And now, yeah, you walked your feet out a little bit?
Yep. A little more?
Yeah, a little more.
All right.
Try to keep equal weight through the feet.
Yep.
Push it in, man.
Oh, dude, I want to cry. This is so nice.
Keep it up. We're just working the arm up so you can get more motion. Talk to my foot.
Good. I feel like I'm just not flexible enough.
Yeah, no.
You know, I'm like, dang, I can't really do this.
Yeah, now you're just running into the stiffness. Keep it going.
That's good.
Cool.
Hand's not bad at all.
Push this arm up, like get it straight. There you go. That's it.
Got a quick itch.
It's cool. Yep. Itch free. Foot's good?
Foot's alright.
Cool, man. Keep it going. Stiff there.
I'm gonna keep this off.
Yeah, keep that off. All right, so this is after he was all scratched up, basically got in a fight. This is after what, like an hour and a half of work?
Yeah.
So much more midline, not as shifted. Symptoms, how much better? 0%, 100% is it's gone, 0 is nothing, or 0 is no better.
I have no symptoms right now.
So pretty good.
Yeah.
All right, tuning out. Well, that was pretty interesting for everyone. As you can see, right after just one treatment and sort of at the end of the treatment there, an hour and a half, a lot of hard work later, he was able to move much better and be more upright. So I want to explain sort of what happened there for anybody watching and sort of the theory behind the treatment and what we did there. So here's Nick, right? So his shoulders were off to the right. And his hips sort of off to the left, so he was shifted, if you will. And you can sort of see, sort of like a slinky here, you can see sort of that there's a gap on this side. So it's a telltale sign of a disc herniation that's sort of off to the one side. And that, right, if there's a bulge over here on this side and it's annoying a nerve as it goes down the back of the leg, then not only are you going to get symptoms all the way down the leg, but it's going to be very difficult, right, to sort of stand up straight because there's something blocking us. So you'll see that people shift often away from the side of pain and a little bit forward because it's very difficult to get back to that position. So, you know, what we did is we just gradually, using certain movements over a long period of time, an hour and a half of work, right, we were gradually able to, you know, work into that restriction and get him neutral. And then, right, he can walk, sit, and do things better. So the treatment is to correct this. Trying to massage this out or crack this out or float therapy this out or inversion table this out is not going to be the solution. You actually, this is something when people lay down, they feel pretty good. That's usually the only thing that will make them feel good, as in the case of Nick. And as soon as they stand, they just go crooked again, right? So this actually needs, you know, some coaching and sort of manual correction, if you will, to try to improve this condition. And that's the reason Nick wasn't getting better. He didn't have the right treatment. Now, with that being said, as I was explaining, Nick experienced something we call centralization. So he had his pain going all the way down his leg, kind of to his ankle. And what we see is that generally the worse a nerve you know, issue, or the more the nerve is irritated, the further the symptoms down the leg, the symptoms will go. So it's much easier to treat somebody who just has buttock pain versus somebody, like in Nick's case, who is shifted and who has, you know, pain all the way down basically to the ankle or to the foot. It can't go much further. Generally, we see it. These shifts have to be corrected, you know, within 6 weeks. 6 weeks being the max to prevent other things needing to be done. It gets much more difficult and stiff after that. Nick found us at the right time. Yeah, so, you know, his nerve was really aggravated. He had a bad back condition that sent symptoms all the way down to his leg. But as we were able to correct his positioning, what we noticed, and you probably saw in the video, is that, you know, his symptoms, he's starting to feel it up in the buttock a lot, right? And then eventually, one visit later, barely anything. So notice that, or just know that that's a phenomenon we call centralization. And it's this idea that, you know, the worse a problem is, the worse, the further away from the body the symptoms are. As the condition improves, the symptoms march up. And sometimes they intensify as they get up. So, you know, if I was to see Nick in a week, and they tell me, hey, Dr. Charlie, you know, we were doing really well in visit 1, my symptoms, you know, were really bad in the buttock, but then they came in the next week and now they're like, hey, now my pain is all the way down in my toes. Well, that's not good. But somebody who comes to me and says, Dr. Charlie, you know, this is what we were looking for to guide how we could treat him. I have bad pain in my foot, but, oh, the more we do it, it's getting really bad in my calf, really bad in my buttock. I'm okay with that because the symptoms are intensifying and they're coming closer up to the spine. That means we're on the right track. So for anybody out there who maybe knows somebody with this problem or is dealing with it, call 484-552-3767. Would love to help you out. Thanks.